All right, let's dive into a topic you specifically requested, gum cancer. You came with some info, which is great, but we're here to break it all down. Make sure you feel good about what it all means.
It really is different, isn't it? Reading about something and really understanding it. Let's get you feeling confident about gum cancer.
Exactly. So gum cancer, what is it exactly?
Basically, it's a type of mouth cancer or oral cancer, like that definition you shared. Gum cancer is a type of mouth or oral cancer. It forms when cells in the gums grow out of control, forming lesions or tumors.
So it becomes cancer when those cells grow out of control.
Right. Normally, cells know what they're doing. They divide at the right time, they die off when they should. It's all very organized. But cancer cells, they're the troublemakers. They just keep multiplying and multiplying, stacking up on top of each other, and that forms the lesions and tumors.
So we're not just talking about the gums themselves when we talk about this cancer.
Exactly. It might start there, but because it's oral cancer, it can show up in other parts of your mouth too.
So it can affect like your lips and your tongue, even
Yes.
the inside of your cheeks. That's wild. I didn't realize it was so widespread.
It really is. And that makes it even more important to talk about how sneaky this disease can be. Gum cancer is good at pretending to be something harmless.
Okay, now that is a little scary.
Hmm.
It's like it's hiding in plain sight. So what kind of things should we be looking out for?
Well, think about those little mouth things we all deal with, like canker sores, a little gingivitis, or a dry patch that just won't quit. Those can actually be early gum cancer signs.
Are you serious? I would have just ignored all of those.
Yeah.
So what else besides those? Are there other signs that it might be something worse?
Yeah, those common things can be tricky. So you also have to keep an eye out for the less obvious things, like sores that just won't heal, bleeding or pain, or maybe even a lump in your cheek.
I guess those make sense.
Yeah.
But some of the things in our research were really surprising, like trouble swallowing, chronic bad breath, even earaches. How can those be related to gum cancer?
Right. Sounds strange, but it makes sense when you realize how connected everything is in there. Like the earache thing, it's because of all the nerves in your head and neck. When a tumor grows, it can press on a nerve, and then boom, you feel that pain all the way up in your ear.
Oh, wow. So it's like a domino effect. One thing leads to another, even if it seems totally random.
Totally. Our bodies are complex. A symptom in one spot could mean something's up somewhere else entirely.
That's a really good point. So we know what to look for now, but is everyone equally at risk for this, or are some people more likely to get gum cancer than others? That's what we're here to find out. We want to know who's most at risk, right?
You got it. Not everyone has the same chances, sadly. Remember that info you sent over from like the National Cancer Institute and the American Cancer Society? Those are the pros, and they say some things definitely make you more likely to get this cancer.
Okay, so hit us with it. What are the things to watch out for?
Well, no surprise here. Tobacco use is like the worst offender. And not just cigarettes, cigars, chewing, tobacco, pipes, the whole shebang.
Yeah, it makes sense given how bad tobacco is for, well, everything. Anything else on the danger list?
Drinking too much alcohol is another big one. And then, get this, the sun. We protect our skin from UV rays. We got to do the same for our lips.
Right. Lip balm with SPF. Gotta have it. It's kind of crazy, though. All these things affect your mouth, even without cancer in the picture, huh?
Exactly. Everything's connected.
Yeah.
And speaking of connected, there was one risk factor you sent that I thought was super interesting, HPV, human papillomavirus.
Oh, yeah, yeah. I remember that. I knew it was linked to some other cancers, but not oral cancer, too.
Yeah, it's becoming a bigger concern. More and more research is linking HPV and certain oral cancers. The good news is there's a vaccine for it. Something to chat with your doctor about for sure.
Wow, okay. Always good to be informed and have those convos with your doctor. So say someone's worried now maybe they have symptoms or some of these risk factors. What then? How's gum cancer diagnosed anyway?
Early detection is everything with cancer, this one included. That's why those regular dental visits are so important. It's not just about cavities. Your dentist is trained to spot signs of this stuff.
So those checkups could actually, like, save your life. That's intense.
Yeah.
But what if they do see something weird during the exam? What happens next?
They might do what's called a brush biopsy. Totally painless. They just kind of collect some cells and send them off to the lab. Depending on what comes back, they might do a more in-depth biopsy where they take a tiny tissue sample.
And if it is cancer, what are the treatment options like?
Good news is we've got ways to treat it. The main ones are surgery, radiation, and chemo. Your doctor will figure out the best plan for you, looking at how advanced it is, where it is, your overall health, all of that.
A personalized approach then, which makes sense.
Definitely. And never forget, there's help out there no matter what stage you're at.
Wow, we covered so much today.
Yeah.
From what gum cancer, even IS, to those sneaky symptoms, who's at risk, and even the treatments. If you remember just one thing, it should be this. Early detection is key why. Go to the dentist, pay attention to your mouth. Those things can make all the difference.
Couldn't have said it better myself. Knowing is half the battle with health.
You said it. Well, there you have it, another deep dive in the books. Stay curious, stay informed. We'll see you next time.